Today, I shall talk to you about a very common surgical emergency seen in clinical practice called appendicitis. This is seen across every age group. It can be seen in newborns till the very old people, and this is due to an inflammation of an organ called appendix, which is a small tube-like structure the size of the little finger of a 5-year-old, and this is seen at the junction of the small and the large intestine. It is somewhere in the right lower abdomen. Now, when the reasons for appendicitis are not very known, but being a tubular organ, sometimes a hard motion, a small pellet can block it. That's called a fecolith, and that can cause swelling of the appendix. And when that happens, the appendix gets swollen and becomes engorged, red, and it becomes very painful. The common symptomatology is that there will be sudden abdominal pain, and usually this starts at the region of the umbilicus and may start with vomit or sweating or abdominal distension or abdominal discomfort, and slowly in about 6 hours time the pain gets settled in the right side of the abdomen, and you'll see patients clutching their abdomen and not feeling good at all. When you can make out from the face of the patient that the patient isn't good. Now, this obviously will require the patient to be taken to a hospital and seen by a clinician. And majority of the times the diagnosis is by clinical examination. The history will be very typical, and on feeling the abdomen one can make out that there is tenderness, or it's very painful when the doctor presses the abdomen on the right side, and that makes the diagnosis. But then all the patients, we tend to do some tests which includes blood counts, and the blood count will suggest that there is some amount of infection by reading what is called as a WBC count, which is raised more than normal. And very commonly we also do an ultrasound scan abdomen. This is done not exactly for the diagnosis of appendicitis, for that is to rule out other causes of acute abdominal pain, which includes a stone in the ureter or the tube which passes from the kidney to the urinary bladder, the urine passage tube, or some problem with the ovary, especially in women, or the fallopian tube, and also some lymph nodal swelling in the abdomen. And many times the ultrasound can just be normal, may suggest that there is some infection in the intestine, like colitis or enterocolitis due to food poisoning. Once the diagnosis is made, then it's time to decide whether surgery is necessary. Now, in very rare cases, we also do a CT scan abdomen. Actually, these days CT is done much more commonly, which will give a very clear-cut idea of inflammation of the appendix. Now, not all appendicitis patients require surgery. That's a bygone era where every appendicitis they used to call it a 24-hour disease and need operation. But a good number of appendicitis patients can be treated medically. The appendicitis will be very mild and can be treated with medication. Certain subsegment of appendicitis will require operation, and it is also not necessary that an appendix needs to be operated in the middle of the night. It is not that urgency, because middle of the night operation theatre conditions will not be very congenial, the surgeon may not be very ready, and so on. It can be done in the early morning if it is diagnosed in the evening, or in the night when everybody and every facility is available. And the operation that is done these days is called appendicectomy, where the appendix is removed, and this is done by laparoscopy, where 3 small holes the size of little finger are made on the abdomen, and a telescope is inserted by seeing the appendix on a video screen. I mean, not just the appendix is seen on a video screen, you can see the other organs in the abdomen, and once a diagnosis is made of appendicitis, the appendix is removed. The operation itself will not take more than 15 minutes. Very, very rarely it may be necessary to make a small cut and convert the laparoscopic operation to an open appendicectomy. That will require a few stitches in the abdomen. And in our experience, we do this as a daycare procedure where we operate on a patient, send home in about 6 hours time. A majority of the appendicectomy patients need not stay in the hospital for more than a day. Now, the common questions asked are, why should you remove an appendix as an organ which has got a function? Frankly, the appendix is a vestige. In other words, it does not have any function in human being. It has a function in animals, leaf-eating animals, but in human beings it is not necessary. And removal of appendix in no way alter any digestion or any other process in the abdomen. Now, how many days of bed rest is required? Actually, there is no bed rest required at all. The patient can get back to a normal work in just a day or two. Then, is there any food restriction of appendicectomy? There is no any food restriction. Patients can take just normal food. And there are a few unusual situations with appendicitis. One is if the appendix pain is neglected for 2 to 3 days, a mass like thing is formed in the abdomen, which ideally should not be operated. This has to be treated medically, and in about a week or so the symptoms will subside. Second thing is, if sometimes the appendix may burst and form a pus, localized pus called appendicular abscess, and this also does not require operation. By needle we can aspirate this pus and patients can become all right themselves. So, in effect, appendicitis is a common condition, very commonly diagnosed, but one should see a good specialist to make sure there is appendicitis and also make a decision that requires operation. Operation is fairly simple, it is laparoscopy with an uneventful recovery. Thank you.